Podcasting from the beautiful state of Maine, welcome to another episode of the Learning from Leaders podcast, the show that focuses on identifying and developing the skills and behaviors that will inspire, empower, and compel others to follow your lead. Listen as Patrick's guests talk about the powerful leadership approaches they have identified and developed, which are vital for leading in today's challenging times. These are the same approaches that will positively impact you as a leader too. Learning from Leaders provides the right balance of leadership research with real-world scenarios, making it easy for you to rise above your best. All right, let's start the show.
Hey everybody, I'm Patrick Barano, and I want to thank you for joining me on another episode of Learning from Leaders. This is a topic that I have been thinking about for many months, and I'm going to try and do this in a way that this is not about politics. But I want to talk about the resistance either to wearing masks or to vaccines. And I want to talk about it from the failure of those trying to influence people to do either one of those to understand the science behind influence. So why don't we get into it? As I mentioned, this is not a topic that I will generally talk about on a podcast. I am not going to look at this from a political standpoint, but I do find it fascinating to look at this from a standpoint of understanding influence, because there is so much here that if we look to why people have resisted, many of the things really play themselves out in a lot of the research around influence and persuasion. But I want to talk about this from the standpoint first of resistance. Why do people say no to our requests? And this is work that I do, whether it's with leaders or teams or individuals that are in sales roles. And it's called GREAT. And it's an acronym for 5 reasons that individuals will resist. And as we've been going through this process of either masks or now who's getting vaccinated and who isn't, when I look at people that have resisted, I have continually tried to look at it from this standpoint of which of these 5 resistors are at play here that's creating an environment, either by the message of the person that's sending this, that might be activating one of those. How is it being received? And again, when I look at it this way, it makes perfect sense to me why many people have basically either resisted masks or resisted vaccines. And again, this is not a judgment call. This is not a political statement. This is looking at it purely from the standpoint of why is it that people resist? And again, I'm going to talk about it from 5 different perspectives. Now, could there be other reasons? Certainly. I'm not going to say these are the only 5, but I will tell you, I'm hoping that after you look at these, you'll think differently in terms of how this model that I called GREAT, each one of these is a resistor. And when I'm working with leaders, again, to me, I don't have followers if they're not saying yes to where I'm asking them to go. So to be an effective leader, I also need to understand, why do people resist? Again, these 5 things that I will talk about. How great is my resistance? Which one of these 5? So we talk about it from a standpoint of goodwill. We talk about it from a standpoint of reactance. We talk about it from a standpoint of expertise or experience. We talk about it from the standpoint of apathy. And we talk about it from the standpoint of trust. Those are the 5 resistors that we will run into. If we play this out as it relates to, again, either vaccines or masks, who's asking us to wear a mask? And even though you might have to wear a mask, you're resisting it, potentially. And why are you doing that? So if we look at the first one, which is around goodwill. Goodwill is all about somebody is asking themselves, is what you're asking me to do only in your best interest or in my best interest? And I know those of you that might be a mask wearer or have already gotten your vaccine, you're thinking, well, clearly wearing a mask is in your best interest. Or getting the vaccine clearly is in your best interest to do that. I'm not going to argue that. But what I am going to say is that for those that have resisted, they're looking at this in a different frame of reference. They're thinking about it from the standpoint of, what you're asking me to do is more about your agenda. It benefits you more than it benefits me. You're not really concerned about me. You have your own agenda. as to why you're asking me to do this. For whatever reason, if it's vaccines, there's a financial gain that you're going to get from this. If it's about masks, then maybe it's just about control. But I'm going to ask you to think about that in terms of how important that is to understand that when we feel as though somebody else is asking us to do something, but it's only in their best interest, it's not in ours, we will naturally resist wanting to do that. Again, think about it from a standpoint of leadership. If I'm asking people that follow me, or I'm telling them where we're going, if they think that I'm only asking them to do something that's going to benefit me, I may have to do it, but I'm going to resist. I'm not going to do this willingly. And you can see where that can have a really negative impact in regards to the effectiveness of me as a leader. I follow somebody in that regard out of obligation or out of fear, but not out of want that I have to. Because what you're asking me to do is really not, I don't feel, in my best interest. It's in your best interest. So I came from the biotech industry where I was for over 15 years. When I was meeting with physicians or other providers or staff, nurses, radiologists, whatever I might be meeting with, the pharmaceutical industry and the medical community have a love-hate relationship for each other. They need each other, but there is a lot of distrust within that. And whenever I was going to call on a provider, especially in the area of oncology, which is where I spent most of my time, I would really think that through in terms of how can I create goodwill here? Because I often believe that the oncologist or the nurse I was speaking with, in their mind, they're thinking, is what you're asking me to do in the best interest of my patient, or is it in the best interest of yourself or your company? And that's a big difference. If I don't demonstrate that there's goodwill, that I'm concerned about you and your patient, then there's always going to be a level of resistance in terms of your level of wanting to do what I'm asking you to do or recommending you to do. Now, from a standpoint of goodwill in that environment, I lost both of my parents at 17 and 18 to cancer. My dad died of pancreatic cancer. My mom died of breast cancer. So for me, in terms of demonstrating a level of goodwill, I simply drew off of my own experience of being a family member of patients that suffered through cancer and tried to promote it that way in terms of really goodwill, that I really wanted to come from the standpoint of it was my parents, how would I want a rep showing up to meet with a physician, making sure that it was really what was in the best interest of my parents and not just in the best interest of the rep. When we move on, the next one is reactance. And this one I think is so prevalent today. And reactance is really this juvenile response to being asked to do something too many times or pushed in a certain direction where we naturally want to resist the other person just because we're annoyed at the way that they're pushing us to make a decision on this. And I will say that I've witnessed a lot of self-righteousness around either vaccines or around masking. And everybody thinks they're the authority and they've got all the information. And if you resist either one of those, you're stupid and you're dumb. And I will tell you that regardless of if there's somebody that is not completely educated, that somebody that is told they're dumb or they're ignorant or they're selfish, then you're creating a standpoint of reactance where they're going to dig their heels in and they're going to resist you even more. It triggers what's called cognitive dissonance, which is this noise that happens in our minds that we try and quiet that. And we're going to do it by either ignoring you or just vehemently saying that you're wrong and that I'm right. It doesn't get us anywhere. And I've seen that so much right now when we're hearing people asking people, are you getting vaccinated? I think of this vaccine passports that are going on right now. I don't see how that works in this environment because, again, you want more people to get vaccinated, then this actually, I believe, will be counterproductive. That it's going to create division and resistance more than it's going to create an environment where people want to either mask up, which fortunately we're coming out of that now, or to get vaccinated. So the next that we move on to is expertise or experience. Again, certainly a lot of that going on where in the beginning, right, we had so many different narratives on what we should be doing by either the CDC or the World Health Organization, certain researchers in certain camps stating claims in terms of mask efficacy. Are bandanas good? Do you need to double mask? For people that are cautious anyway, or distrustful or suspicious anyway, when we now add this level of expertise, do you know what you're talking about? That will create resistance. There's been such a variance, and some of the things just very inflammatory. And again, I look at this more as an outsider from a standpoint of influence. But several weeks ago, when Texas went with eliminating all masks, and you hear the label Neanderthal thinking, or you hear somebody else say that this is now, we're in a situation where there's impending doom, and you look at what sort of plays itself out, and neither of those things happened on the level that they were portended to, then what happens is again, you have people that are already on the fence and they begin to question, right? You can't trust the researchers on this. Everybody has their own agenda. When that happens, people are going to resist. And we see so much of that. The messaging on this has been such that it's created a sense of resistance, or strengthened the resistance in those that were questioning in the beginning. Without a sense of being able to speak through clearly the science on this, what we do and really don't know, and not go off of sound bites and things like that, then we're able to persuade people that the vaccination is worthwhile. The safety data is there, and here's the data that we're going to go by, or here's what we do know about masks in a more convincing way based on research. So the next area of resistance is around apathy. And with apathy, it's just like it sounds, right? People are saying, well, the way things are going right now, I don't need to make a change. I don't need to do anything. So you have people that maybe are resisting right now, or either mask or not getting vaccinated, because they're in areas maybe where they say, I don't know one person that's been impacted by this. Or I know of people that have been impacted and they were asymptomatic. And I think this is a big hoax. And again, simply throwing that out there, that if we're talking about people that are resisting either masks or vaccines, that's where a lot of that can be coming from. It's this sense of, I don't see it around me, so therefore it doesn't exist. I don't know anybody firsthand that this has been an issue for, so therefore I'm going to resist in that sense. That's a very difficult thing to overcome for somebody, right? And again, if we just want to call that person dumb or ignorant or whatever label we want to put on them, which that's what we've seen happen, or selfish, we're missing opportunities to have conversations that we can understand the reasoning behind somebody's resistance and then draw them back in. So the last one of these resistors in how great is my resistance is the T in this model, and that's around trust. And again, this to me is another very important one, right? Where we, depending on the news station you watch, right, this is all we hear about. And these stories get so inflamed in terms of not giving all the details about the situations that are going on. We hear of certain individuals dying that are younger, outside of this age bracket, but you need to dig a little deeper to find out that these patients had several comorbidities that probably were involved in this, that this wasn't strictly somebody dying, a healthy young individual dying from COVID. And that's not to say that healthy people did not die, but when a story is put out there and it only gives certain components to it, and you have to dig much deeper to get the full story on it, it creates a level of distrust. Or if I see elected officials not following the same rules that they're imposing on other people, or certain industries get a pass, that they don't have to fall under the same regulations as the rest of the general public, you create distrust, because people will look and say, it's not really about my safety. It's almost back to goodwill again, that this is more about your agenda and I don't trust you. So we can see in that in that model of great, how great is my resistance, that of those 5, you can probably find, and I will tell you, I'm somebody that has been vaccinated, and there are times when I am listening to either other people ask if I've been vaccinated or basically ridiculing in a very self-righteous way why, they can't believe why somebody else hasn't been vaccinated. Well, we don't know their story in terms of why they haven't, but I will tell you, it at times irritates me so much that it's like, I wished I wasn't vaccinated, just right out of that sense of irritation, that resistance in me when I hear that. Now, obviously, I know that's sort of an irrational way of looking at it. That's the reality of it. When people are pushed in ways that are so abrasive for them, it makes it worse, not better, in trying to get them on board. And I think that's the environment that we're in right now. And the next piece that we're going to go to is this is going to come into play again when we try and get people to re-enter the workforce, not just remotely, but when organizations try and bring people back in house on a more regular basis. These same 5 resistors can come into play. I hope this is helpful. Again, this was not meant to be a political podcast at all, but it was very much meant for hopefully a way to be curious and look at why do people resist either vaccines or masks. And if you put it in one of those 5 contexts of how great your resistance is, there are ways that we can back into, and that's a lot of the work that I do, talking about what are the principles of influence that then come into play and help to address those 5 areas of resistance. Because there are ways that we can minimize the resistance that we're going to run up against if we behave in certain ways. And that's what a lot of the work that, I continue to do with my clients to help them, not around masks and vaccines, but it's relevant. It would mean the world to me if you'd leave a rating, a comment, any feedback on this. As you think about those 5 resistors, is there one that you in particular see more than another? I'd love to hear that as well. Until the next podcast, I hope you're able to go out there and rise above your best. Peace.
Thanks so much for listening to this episode of the Learning from Leaders podcast. If you've enjoyed the show, please feel free to rate, review, and subscribe on your preferred podcast listening platform. We really appreciate that effort. Until next time, keep rising above your best as a leader.